Foot fractures. Fractures of the foot happen quite frequently, primarily due to stresses and strains applied to the foot as well as the simple fact that the foot seems to be a focal point for trauma. Stress fractures of the foot. The first foot fracture I would like to mention are stress fractures. Factors that can lead to stress fractures. 1. Too much repeated pressure on a bone forcing it to break. This is known as an overuse injury. That is why it is more common in athletes. 2. Women with low estrogen levels. 3. People with metabolic disease. 4. Limb length abnormality. 5. Poor bone density. 6. Low body weight. Metatarsal stress fractures. The most common site for stress fractures of the foot is the metatarsal bones. In simple stress fractures where the two broken ends line up next to each other and there is virtually little space between the two ends, a surgical shoe, which is a stiff flat-bottomed shoe, will suffice, until the bone heals. Mid-tarsal stress fractures. It is important to note that stress fractures of the tarsal bones such as the navicular or cuboid bone can be much more difficult to diagnose. These two bones may be broken and never reveal any radiographic evidence. Toe fractures. The other very common type of fracture seen in the foot is a fracture of one or more of the toes. There is almost always a history of trauma. The reason I even bother to mention toe fractures is that there is a general misconception that there is no treatment for toe fractures. That could not be further from the truth. When a fracture does not adequately heal, you are left with scar tissue in the fracture site and what is known as a pseudoarthrosis, or more commonly known as a non-union. The significance of this is the fact that the toe may always continue to hurt. Sesamoid fractures. The sesamoid bones are two bones located just below the big toe joint. Their purpose is to act as a lever or fulcrum for the tendons that allow the big toe to bend downward. Fractures of these two bones generally occur when there is a hyperextension, excessive bending up of big toe, injuries. Many times the force of the injury will break the sesamoid bone into multiple fragments. Less frequent to the sesamoids are crush injuries. When there is a history of trauma, certainly a fracture has to be considered, but the harder diagnosis is when there is no history of trauma and there is pain in the sesamoid bones. Many times a fracture in such a small bone, will not show up on X-ray and a bone scan or MRI will be needed to actually find the fracture. A fractured sesamoid can be a very difficult problem to remedy due to its location. A fractured sesamoid is usually casted in such a manner as to keep pressure off the bottom of the foot. Once healed, it can still be a few more months before a person can return to their normal activities. In cases where the fracture does not heal and there is constant pain, the sesamoid bone may have to be removed. This, however, can have implications in the way the big toe joint functions. Read the complete article at www.foot-pain-explained.com/foot-fracture.html